Good morning, good afternoon, and good evening to all of you out there at the Life of the Sacred Journey community neighborhood. I am so thankful every week that you take time out of your schedule, no matter what time it is, to come and join us. So please hit that share button, subscribe if you're watching us on YouTube, and whatever the other languages are. Follow us in all the modes that we're in. So I laugh about this stuff because I am the worst person at any of this technology. I just want to thank Felicia, my producer. If it were not for her, I would not be doing this. She keeps everything going so magnificently. So I just want to thank her so I can be the 63-year-old woman that doesn't have to worry about any of this. Good morning, Sandy and Betty and Mary Lee. It's so good to see you all here with me this morning. I'm hoping that you are all well and yeah, it's been a hard week in California. So we're gonna get started because I really want you to hear from Nicole Howell, a dear friend. Actually, she was one of our first guests on Life is a Sacred Journey when we were just a fledgling podcast on Blog Talk Radio, and Lance Reynolds introduced me to Nicole Howell in the beginning of her career here in this area as the Ombudsman Executive Director over in Contra, Costa County. And then our paths have crossed, of course, because we work in the same field. And you're going to hear from her perspective and learn what Ombudsman is all about, because I still find that people don't understand what that sign means in the facility where their loved one is living or where they're thinking about placing their loved one. I do want to start by saying California is now one of the hot spots for the COVID-19 virus. We had fun on Memorial Day weekend, and that 14-day incubation period that we all knew, we are now paying for it. So when we have gone into triple digits of fatalities that statewide, with a total of like 6,860 deaths and 302,000 confirmed cases statewide. I don't know what to say, because when I saw the news on YouTube, because I don't watch television, but on YouTube, and saw that people were at the beach without their masks, at the parks without their masks for the 4th of July, not practicing 6 to 10 foot distancing, I believe we're going to see another spike in another 14 to 16 days. And so I'm going to just join the other advocates out there, and I'm sure Nicole's going to tell you the same thing. Wear your mask, and if you don't want to wear a mask outside, then shelter in place if you can. I know some of us can't. We've got to go out. We've got to take care of people. We have to do certain things. But come on, we have now been in almost 130 something days of this pandemic as far as in the Bay Area, shelter in place at different degrees of it. And if we really, really, really want to get to a place where we can get back to normal, we're going to have to make some sacrifices. And that means wearing a mask. That means practicing the 6 to 10 feet distancing. So I'm asking you, all of you out there, share that as much as you can on your Facebook pages, in your conversations with your family and friends. The life you save, you remember that PSA? The life you save might very well be your own. So please, 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 I'm begging you, let's get rid of this virus. The vaccine, yeah, it's coming, but it's not coming for quite some time. So it's going to take us digging deep and doing some other things. Good morning, Sister T. It's so good to see you this morning. I want to just say, please, please, please wear your mask. So I want to tell you a little bit about our conversation this morning, and I'm just so excited again. Nicole Howell who I've known for quite some time now, is the executive director for Ombudsman Services of Contra, Costa, and Solano counties. Nicole is responsible for ensuring that 13,000 residents of long-term care in her community have access to the highest level of care, respect, and above all, can live free of abuse and neglect. And before her role with the Ombudsman Group, Nicole worked nearly for 5 years as the director of operations for Ombudsman Services in San Mateo County. San Mateo County is one of the heroes of senior care and has been for many, many years, and she was a part of that. She is a fierce advocate. Everywhere there is a need for a voice to stand up for our seniors and their families, Nicole is there. As I said, our paths cross many, many times. She has worked in the nonprofit community now for a decade, and she attended the University of Nevada in Reno. Shout out to our Reno, Nevada friends. And when she's not working, guess where you can find her? You can find her cheering on the Oakland A's. She's going to have to do that in a different way this year. But yes, Nicole Howell is definitely an individual that is important to the level of care that is being provided in our long-term care facilities. And I want to welcome Nicole Howell to the mic. Good morning, Nicole.
Good morning, Michelle. Thank you so much for having me.
Oh, I am so excited about having you. And I'm going to say to my audience again that life is a sacred journey. Please hit that share button. Have your own video live party, but let's pass this on because this is going to be some important information. I'm really excited to hear your voice, Nicole. I went back and looked, and you were one of my first guest on Life is a Sacred Journey, and Lance was our board president at that time, and he actually introduced us to each other. So thank you for coming back. It's been 7 years.
Oh my gosh, that's amazing. Yes, I was honored to be on the show then, and it's good to come back and continue the conversation.
It's great. Well, a lot has changed in our lives. You have taken on a wider responsibility of the Ombudsman Group. You have dual counties that you're looking over. But before we get into COVID and all of that, would you explain to the listening audience what Ombudsman does and what the functionality and responsibility of the Ombudsman organization is?
Yeah, so I should say we're also Contra, Costa, Solano, and Alameda County.
Oh my gosh, okay, over here with me. Yes, that's right. Three counties. So Contra Costa. Wow. Well,
yeah.
Tell us.
And Alameda. So we've got a diverse array of residents and families that we serve.
And when you're serving them, the vision and the purpose of the Ombudsman Group is what?
Yeah, so we're a federally mandated program via the Older Americans Act, and our job is to protect the resident. We work for them. So our goal is to address issues related to quality of life and quality of care. So if someone in a long-term care facility, so that includes skilled nursing facilities, what you might call assisted living, or we sometimes call it a sixth bed, which is like an assisted living in a house. So our job is to make unannounced facility visits to receive complaints from residents or their family members or their friends, as well as mandated reporters, and respond to those and find solutions. So if there's a concern about not getting the right food or not getting the right treatment or therapy, our ombudsman go to the facility and help to resolve that issue. And our services are free of charge. And as you said, we have a big poster in the facility, but sometimes people don't realize that there's people behind the poster.
Exactly.
Sorry.
No, that's exactly right, because I church with a community where, unfortunately or fortunately, however, where your perspective and what context you're living in, as they have begun to age, they've had to look at assisted living and things of that nature. And they see the sign, but they don't really understand what that means and what protections that gives them.
Absolutely.
So what does an ombudsman do? Are they paid?
So sometimes. So ombudsmen were intended to be community-based programming. So there are indeed volunteer, what we call field ombudsmen. They have undergone an extensive training program. They receive ongoing education on a monthly basis. But there are staff ombudsmen because it takes, a structure to really run their organization. So in our area, we have paid long-term care ombudsmen who are responsible for specific regions. And they have, in one case, I have a staff member who's been with me for 16 years.
Wow.
And in others, we have folks entering the industry. Right now, a long-term care ombudsmen are prohibited from entering facilities. And we're planning our return to that here in California. But volunteers won't be in facilities for the near future just because we want to be cautious, of course, about COVID.
Exactly.
I have some volunteers who've been doing this for many years. They're quite dedicated. They are often folks who are retired social workers, attorneys, investigators who really want to have a meaningful retirement, as well as emerging professionals who are interested in working with older adults. But then we do have a very committed staff as well.
Well, I'm happy to hear that. If any of you are out there and after we either come out of the pandemic or just to explore, I know I have some friends that are newly retired. As you retire, think about becoming an ombudsman. And Nicole Howell, because of the 3 counties that she covers, she would be the individual that you would be learning from and being a part of a team that is vital to ensuring that facilities, we're not policing them. I remember, Nicole, when I first met you, you said, I did not take this job to police facilities. I took this job to partner and serve with them. Is that still your philosophy?
Yeah, certainly I like to think of it as collaborators. Sometimes as collaborators, you call the other person out and you're like, hey, you're not really doing your best work here. So certainly sometimes we are assertive and we have a harder line because we work for the resident. We want what they want. But generally we find that if you know a facility, if you work collaboratively with them, they want to do the right thing. They entered this field because they care about older adults and they just need help finding a solution.
So how are our facilities doing? I know that ombudsmen cannot go into the facilities at this time, but I know there's a reporting mechanism to the ombudsman group so that you know still what's going on in facilities. How are we doing in California?
Yeah, and I should say, just because we're not in facilities doesn't mean we're not resolving issues. My staff are on Zoom and FaceTime and Google Hangouts all day long, working with residents to resolve issues via care conferences or meeting with families or talking to facilities. So while we can't be in the facility, we're still very much resolving issues.
Excellent.
In terms of how we're doing in California, we have been quite touched, as you said at the start of the show, wear your mask, by this insidious disease, and it has sort of taken a weakness in the system of folks who are maybe a little more frail.
Yeah.
And we have a lot of staff going in and out. And so we do have active infections across California and in the 3 counties that I cover.
Wow.
What I will say is, unlike the early days of the infection where we were having problems getting PPE and we were just all trying to adjust so rapidly, facilities have been able to secure the supplies that they need, but they have been in sort of shelter at home or safer at home for more than 90 days, and that takes a significant toll on residents and staff. Yeah. And so I think that we are doing it as best as we can, and I think that we still have a long way to go.
Yeah. And in the facilities, I know that I heard yesterday on the way home on NPR, there's a facility in Baltimore City where they have had no cases of COVID. But what I realized is that it's a smaller facility. And then what they had done is really worked with the staff, and it was about training the staff so that when they left the social bubble of that facility, excuse me, they were keeping in mind that they were going to return there. Staff training is so important right now. And so how is the Ombudsman Group reaching out to facilities to reinforce some of the sanitizing, disinfecting, and all this other stuff that we've been talking about?
Yeah, and I think it's important to note the issues around infection control are basic issues of hand washing and donning and doffing appropriate PPE. This is a disease that we can prevent, and if you act in your personal life as if you care for what's going on in your professional life, we really can find the end to this. So as Ombudsman, what we're doing a lot of is talking to facilities and providing them resources. In Contra, Costa County, we have participated on a task force to prevent the spread in congregate living facilities. We worked to create a binder for training for facilities. We have done PPE distributions with the assistance of Choice and Aging and the Emergency Operations Center. And we are continually talking to facilities about what are they doing to prevent the spread. We are preparing to launch several webinar training series or online sort of listening sessions so we can keep reinforcing these lessons with facilities. Those will be coming in the next 30 days or so. Because facilities, again, they've been in this a long time, and they're through the first part of it, but it just keeps going on and on and on.
Yeah.
And we need to be fair, we need to be reminding our staff, first of all, it's challenging because staff often work at multiple facilities, and I continually say that staff should be paid a fair salary so they can have one job and just work there and not risk transitioning the disease from one facility to the other.
Yes.
The other part of that is that, again, we should be incentivizing our frontline caregivers to stay home in their homes, to not go out for that Memorial Day party or that 4th of July beach celebration, to really be staying and realize how critical their role is right now, and incentivizing both with compensation, but also other things, grocery delivery, anything we can do to help them stay in a smaller bubble.
Yes. Yes. Nicole, you are speaking to my heart because I have always said, I began my first medical job or medical field job was as a CNA and in college. And I learned then that there are ways to do things and there are ways to do things. And I kept, throughout the years, I did it again when my children were young. I was a CNA in the facility. And what I realized is that for me, it was a second job, right? And then when I started talking to other people, it was also a second job for them. But the difference was I wasn't going to another skilled facility, and they were, as well as many of them were also working for home care agencies and doing private duty kind of work. And so I remember that, and it touches my heart only because I was doing that to get through a period of time where money was a challenge, where I was trying to bring more financial stability into the home. But it wasn't my life. It wasn't something that I was looking forward to as far as long-term. And this some of these folks that we're talking about, these essential workers, this is the way they have to live their lives in order to survive. And so advocating for better salaries and better benefits also means that they have stable careers and they can sustain their families without having to work 2 and 3 jobs to function and to live. I mean, that's a lot to ask of people.
Mentally and physically, especially during this time.
Yeah. Yeah, and then I was hearing that there was a couple of facilities that were having PPE problems in the beginning, and but yet people were still going to work because they were caring about the people that they were caring for in those facilities, and some of those people have since been diagnosed with COVID-19 in recovery, but still diagnosed. What would you, as far as your advocacy hat, which I know you always wear, what as a community could we do to support Ombudsman, to support what you're doing and in the congregate facilities that you serve? How could we help?
Well, thank you for asking. I think a couple things you could do, which is stay informed. And what I mean by that is find out what you can do to support your local facility. I guarantee that within 2 to 5 miles of wherever all of us live, there is a long-term care facility. Reach out to them, ask them if they need something. Ask them if they need games for the resident. Ask if they can provide food for the staff for a meal. Find out what you can do to help engage in that community from a distance.
Mm-hmm.
I think that is so important right now that we all have a responsibility to the elders who live in our community, and especially right now where they're so locked down and they have so little activities to do.
Yeah.
That's the first thing I would do. The second thing I would do is reach out to your local ombudsman program, see if they need assistance, because right now, while we may not be in facilities, we are calling facilities on a daily basis. We are fielding an insanely volume of calls of asking for resources and information. So reach out to your local ombudsman program. And as I always like to say, is connect with your local area agency on aging. Yes. They're the hub for all of the aging activities in your region. And they might have information or resources that you can be of assistance.
And also, does the Ombudsman group take donations?
We absolutely do, and I think that's especially important during this time. And we're taking two kinds of donations. Always welcome to make a financial gift, and we certainly use those with our best interest in mind for the residents and for organizations. We're also accepting donations of tablets right now. Oh. And our goal is to take those tablets and turn them around and give them to facilities so that residents can still talk to their ombudsman. Okay. But if you have a tablet lying around that you're looking to, maybe upgrade during this COVID time, or if you'd like to donate $50 so we can go buy a new Amazon Fire tablet, that would be much appreciated. And you can find information about that on our website, which is ccombudsman.org.
Say it again, Nicole, so they can hear you, because this is important. This is something that everybody can participate with, even if they're not, because we have listeners outside of the state of California. You can go on the Ombudsman website, see their address, send them a gift card for $50 to Best Buy or whatever, so they can go and buy a tablet, or you can buy the tablet and send it if you feel like going through that, or you can, I'm sure, go on their website. I'm sure they have a donate button that you can push and make that donation, or again, help with phone calls or any of those things that would support the work that they're doing. So I'm gonna let Nicole tell you again the email or the website address and phone number also, in case you want to leave a message. So Nicole, go ahead, share with them.
Yeah, so that our website is CC, so 2 C's, Ombudsman, OMBUDSMAN.org. And what's really great is we have an entire COVID-19 resource section. So if you're looking for information about COVID, you can find it there. And then you can also find information about our tablet turnover program.
Oh, I love it. I love it. I love it. So any last we believe it or not, this show, when we spoke 7 years ago, that we were doing a 1 hour podcast. I can't believe that. And now, in this time of social media and learnings, we now do a half hour, and it seems to go by so fast, right? But in the last couple of minutes that we have, Nicole, and again, thank you so much for getting up. I know you're already up getting ready for Zoom calls and all of that. Thank you for fitting us in your schedule to share this valuable information. But during this time of COVID-19, we've been expressing to our listeners out there the importance of masks, the importance of hand sanitation, the importance of sheltering in place, the importance of the social distancing. And because I belong to a faith-based community where people are missing being together, as well as families are missing being together, as a community-based professional, would you share, just give your words of wisdom so that people understand that we really are trying to make this thing go away and subside?
Oh, I so agree with you. And I just want to say, I'm with you guys. I'm struggling too. I am in my home. I haven't seen my parents since Christmas because they're older adults. It is really hard right now, but I think the sacrifice is worth the return. The more we can stay in the house right now, the more we can diligently wear masks, wash our hands, maintain connection digitally and other ways, Zoom or phone or whatever is possible, that, online church service, those kinds of things, that will help us end this disease and will ultimately get us back to where we need to be. I think of World War II. I remember I used to read a book called The American Girl Collection, and there was this girl, Molly, and she was, I think, a fourth grader. And it was during World War II, and she talked about the victory gardens and the way that the community came together to raise funds for troops who would return and make sacrifices for them while they were overseas. This is what this is right now. We need to make sacrifices for each other so we can all come back stronger.
Yes, and in this time when, and we just put up, my producer Felicia just put up in the feed the connection to the Ombudsman group and so that you can get in contact with them and, find a way to volunteer during this time. I think that will also help the sheltering in place, because when you can do something for someone else, it always is uplifting and invigorating. So that this is a really good opportunity to do something, so you don't feel so, I don't know, like don't have anything to do. So I want to thank Nicole Howell for her work. Again, Executive Director of Ombudsman Services of Contra, Costa, Solano, and Alameda County, and just for her hard work, advocacy, as well as enlightening us this morning and all of you on what the Ombudsman Services is about, how you can become engaged and involved in what they're doing, how you can donate, how you can help some of our seniors become technologically engaged. And I know there's a lot of United Methodist women out there who follow Life is a Sacred Journey. This sounds like a good one for us. So let's partner and make this happen. If you live in these counties and you can do something about getting technology to seniors through the Ombudsman group, please do so. Nicole, I wish you the best, and I hope that you continue to stay healthy and that your mom and dad are healthy and safe. And I'm so sorry that you have not seen them since December, because I know how close you are to them, and we will just continue to hope that and pray that this disease leaves us really soon, because it really is something that we could never have imagined we would be going through in 2020, but we are. So thank you so much for your time. So I want to thank Nicole Howell again for joining us on Life is a Sacred Journey. I want to thank all of you for coming back every single Friday at 8 a.m. to really just learn and put up with me, and I thank you for that. But I also wanted to say to Nicole, I know she's still on the line, Now that you're in Alameda County, let's get together and have a Zoom call so that ASAP, we're open Monday through Friday, that we can do to support the Ombudsman services in Alameda County. Please know you have an ally and an advocate and a partner with us as well.
Oh, thank you so much.
Yeah, definitely, definitely. All right, everybody, be well. Put your mask on, wash your hands, use your hand sanitizer, socially distance. It's okay. We're all going to get through this. We are. But as Nicole said, we're going to have to sacrifice a minute. And it's going to be all right. It's going to be all right. So bless you. Faith, hope, and love is what's going to get us through. And when we get through this, we will know that we have been just like our ancestors and the people before us. We'll have come through something together, and it will forever change the humanity. So have a great weekend. Stay safe. Hug yourself. Give yourself a big hug, and blessings. God bless you all.